Goals are really important, but would you talk about what you mean by goals? Because for me, I'm thinking for someone with PAD specifically, you have different people that may say, my goal is to just be able to walk around my house or around my nursing home pain free. Another might say, my goal is to be able to play with my grandchildren pain free and be able to keep up with them. And another might say, hey, you know what? I want to actually walk a 5K. And so that would literally determine the type of treatment that a doctor would do.
I think having an understanding of your goals is the best way for you as a patient to make those changes that are so necessary for risk reduction. That's the first point. And second of all, it absolutely frames how we talk about interventions. I'll give you a couple of examples. I had a patient in my clinic who asked me about a procedure for his heart, which is actually not my area of expertise, but we had established trust and rapport, and he wanted my opinion about whether he should have a procedure for his heart valve. And I asked him, what friend is most important to you? Is it, he was active in a particular hobby. Is it being able to get back to this hobby? Or is it, just being able to stay at home with your wife and avoiding the chance of any complications that might land you in a nursing facility or in the hospital for a prolonged period of time? And I didn't even get an answer to those questions, but I could see the light bulb go off in his brain. And it was clear that now he knew how to answer those questions and how to think about the procedure that was on the table for him. And for PAD patients, it can be a myriad of things. I'll share one more story, then we can get back to some other topics. But I had a patient who was ill with rest pain and wounds on his foot, had no idea he had peripheral arterial disease, but he was sort of living, paycheck to paycheck and couldn't afford the time in the hospital to recover from a major bypass operation, which is, I tell patients, give or take about a week in the hospital and potentially then a nursing facility afterwards, depending on their level of activity and fitness and their needs post-operatively. And he said, Doc, I can't do it. You cannot do a bypass, even if it's the right thing for me. I cannot be in the hospital for 2 weeks. I cannot be away from home. I need to be home. And my goal is to get out of the hospital as soon as possible. So you can do whatever you can do through an angiogram or through a minimally invasive approach, endovascular, and that's it. And no bypass, can't do it. I have to leave the hospital within a day or two. And I said, okay, right? Is it what is recommended by the clinical trials and our guidelines? No, it wasn't, but it was his goal. And fortunately, I had a good outcome and he feels much better, but he was able to get home and that was most important. And he was willing to take the risk of losing his leg sooner to be able to accommodate that goal. And, that's my job. My job is not to, follow some checklist. My job is to work with my patients and get them where they need to be in their mind and in their heart.